Hello students, welcome to EPG Pathshala. I am Dr. Renal from Department of Anthropology, University of Delhi. Today I am going to speak on the module Epidemiology of Aging from the paper Biosocial Gerontology. The learning objective of these modules are to know about the epidemiology of aging and demography, to understand the different diseases associated with the aging, and to know the nutritional requirement of the aged. Let us have a brief introduction on the aging. Aging can be defined as a progressive functional decline or a gradual deterioration of the physiological functions with age, including a decrease in the fecundity or the intrinsic, inevitable and irreversible age-related process of loss of viability and increase in vulnerability. Aging is an important and unenviable phenomena that occurs in every individual. The aging of the human population represents one of the most significant issues in a society. It is not only the increase in the number of the older individual in community, but also the population's health and vitality are a widespread concern. With an increase in the older population, there is a need to understand the health issues concerned with the population for the better adaptation and stability. The purpose of the epidemiology is to describe and explain patterns like incidence and the prevalence of the health outcomes as well as the duration and the quality of the life in the population. Epidemiology is well suited to the examination or examining the patterns of the health and functioning in an aging population. The epidemiological transition theory was first published by Omran in 1971, where he proposed that the increase in the life expectancy has been caused in part by the substitution in late onset degenerative causes of death such as heart diseases and cancer, replacing the death caused by the early onset infectious and parasitic diseases. The epidemiologic transition was caused due to a variety of factors which include the socio-economic as well as the forces of modernization. These factors include the improved medical healthcare facilities, sanitation, housing, hygiene improvement in food production, nutrition, processing, etc. Historically, age has been a very key variable in epidemiological studies of the disease and disability. In fact, age is closely associated with the occurrence of the disease and disability. Although age is very closely linked with the study of the epidemiology of the aging as a separate field is of the recent origin. It is, however, useful to consider how the field of epidemiology compares to the other fields that focuses on the aging like demography, gerontology, and geriatric demography. In some countries, the increasing number of the old aged will challenge the national infrastructure, particularly the health system. This phenomena is driven by decreased fertility and improvement in the longevity. With the advancement in the modern medicine, there is general increase in the life expectancy. Therefore, more people are expected to live beyond the age of 60 years and above. This increase can be illustrated in the table given by WHO in Global Health and Aging report, where the two most populous countries, that is China and India, is taken into account for the number of the aged. China's older population, which is over 65 years of age, will likely to be increased to more than 330 million by 2050, and in India to be over 227 million by 2050. The increase in the population needs to be taken into account so as to provide the healthy aging for the increasing age groups. Now let's understand the aging and health. The epidemiology of a disease conditions and disability associated with the age has progressed over the years. The incidence of a number of the pathology increases with age. It is a well-known fact that physiologic processes, including the functioning of the immune system and digestive system, declines with age. Although health issues are an important concern for elderly, not all aged people are sick and disabled. Susceptibility to infectious and the non-infectious diseases, however, increases with the age. Aging is a lifelong process of nature which is accompanied by certain psychological, anatomical, and nutritional as well as physiological changes. Dementia, depression, cognitive losses, alcoholism, neglect, and suicidal tendencies are some of the mental health problems faced by the elderly. This figure shows the pathologies associated with the increasing age. Now let's study some of the diseases associated with the aging. For example, the number one is dementia. The American Psychiatric Association defined dementia as a decline in the cognitive, intellectual, and memory function due to the disease processes affecting the central nervous system. Dementia is now the fourth leading cause of the death in the adult population, a trend which can only worsen with the increase in the life expectancy. The cause of the most dementia is unknown, but the final stage of this disease leads to loss in the memory, speech, and other cognitive functions. The risk of the dementia increases sharply with the age, and unless new strategies for the management and the preventions are developed, it is going to place a huge demand on the health and the long-term health care providers as the world ages. To fully understand the behavior changes, one must use a systematic individual-based behavioral examination. The mental state examination is an important assumption of the important cognitive and emotional functions that are commonly and characteristically disturbed in the patient with organic brain diseases. The most essential element of the dementia is intellectual decline. It is an acquired and sustained deterioration of the memory and other intellectual functions, which include the inability to critically evaluate the events and inability for objective decision making. Now let's see what is Alzheimer's disease. Alzheimer's is one of the most common degenerative disorder that produce progressive dementia. Alzheimer's disease is also called as primary degenerative dementia, or as previously called the pre-senile dementia. Although Alzheimer's disease can occur at any stage or at any age, it is likely to be seen with the increasing age. As the disease is more common with an increasing age, it is very rare among the age group of 40 to 45 years, although it can increase in the age group as 50 to 65, and in the age group over 60 years, it is very common. Lot of effort have been made by the researchers to study the risk factors of the disease. However, only 2 established risk factors have been made, of which is the increasing age and the genetic predisposition. So far, 3 genetic defects have been identified on the patient, that is chromosome 14, chromosome 19, and chromosome 21. The next disease is the osteoporosis. It is a metabolic bone disease occur due to the reduction in the mass of the bone per unit volume. Osteoporosis or bone aging is seen to be more prevalent among the women as it progresses faster when they lost the estrogen support because of the attainment of the menopause. With the increase in age, there is a decline and the osteoblast cavity is reduced, leading to the reduction in the bone mass with a general increase in the number of the older adults, the osteoporosis will be a major medical as well as the socio-economic health issue. Osteoporosis is of two types, namely type 1 and type 2. Type 1 osteoporosis occurs in the postmenopausal women between 51 years to 75 years of age, which is characterized by the disproportionate and accelerated loss of the trabecular bone, whereas the type 2 osteoporosis is found in large number of women over 70 years of age, and it is accompanied by the fractures of the neck of the femur, humerus, tibia and pelvis. Osteoporosis manifests as the fracture due to the insignificant trauma and is usually suspected when X-ray is done for the unexplained back ache, persistent pain after the minor injury, fracture after an insignificant trauma, and is confirmed by the CT scan. The other category of the disease is the renal diseases. Age-related changes in the kidneys occurring in the elderly have been studied widely. Some of the anatomic and the functional changes related with the aging are decrease in the total kidney mass, decrease in the total number of glomerulus, increased number of the glomerulonephrosis, decrease in the total number of tubules, increase in the tubular diverticulae and thickness, basement membrane. The functional changes include the decrease in the renal blood flow, decreased response to the vasodilation, increase in the filtration, fraction, etc. Many systematic diseases have been known to cause the similar pattern of the glomerular injury, antedate and even worsen them. Diabetes mellitus, essential hypertension, atherosclerosis are the main examples. Epidemiological studies have revealed that nature of the disease occurring in the elderly are no different from those occurring in the younger population except their prevalence rate. It has been found that the renovascular disorders and urinary tract infections are the most common, followed by the diabetic neuropathy, renal amyloidosis and glomerulonephritis. Let's have a look at the thermoregulatory disorders. The thermoregulation, like the homeostasis, is a heart regulatory mechanism which is the total product of the heat generation in the body and heat loss by radiation, evaporation through skin and expired air, conduction and conservation. This process is maintained through the activity of a thermoregulatory center, that is TRC, located in the perioptic anterior hypothalamus and posterior hypothalamus. With increase in age or aging, many changes occur in the various constituents of the thermoregulatory mechanism, resulting in the inefficiency to cope with the temperature variation. The thermoregulatory disorder include hypothermia. Hypothermia is a condition where the core body temperature is at 35 degrees Celsius or 95 degrees Fahrenheit or less. The lowering of the environmental temperature gives rise to the cutaneous vasoconstrictions through cold receptors in the skin, and to cope with it, behavioral changes like moving indoors, use of excessive clothing, shivering, etc. lead to the heat conservation. Hypothermia is most commonly seen in the elderly due to age-related alteration in the thermoregulation, concomitant malnutrition, reduction in the physical activity leading to decreased heat generation, decreased lean body mass, greater incidence of the disease, and frequent use of the drugs that reduce the thermoregulatory mechanism. Hypothermic patients need intensive care, especially monitoring core body temperature, cardiac respiratory status, and the electrolyte and the acid-base metabolism. As hypothermia alters the drug metabolism, careful monitoring of the drug administration becomes essential for the management of hypothermia. Now let's have a look at the hyperthermia. Hyperthermia occurs when the core body temperature is elevated when heat generation exceeds the heat loss. High environmental temperature along with the increasing humidity, which causes the diminution in the cutaneous heat loss, is the leading etiological cause of hyperthermia. High temperature can cause the heat-related syndrome among young and the elderly. In non-acclimatized elderly, non-exertional hyperthermia is more common due to the age-related impairment of the thermoregulatory mechanism. Factors like anticholinergic drugs administration and dehydration due to the low fluid intake or increased fluid loss as a result of the diarrhea or diuretic-induced diuresis are some of the contributing factors. Hyperthermia can be managed by the external cooling of the body, especially the head and the trunk, and is more effective than the intense surface cooling. IV fluids can also be induced to combat the hypovolemia and the corrections of the electrolyte, acid base, and other metabolic disturbances. Drug-induced hyperthermia is very common among the elderly people because drugs are frequently prescribed for various illnesses and problems to the elderly. Drugs like anticholinergic drug causes centrally resetting thermoregulatory center at higher level, peripherally through the reduction of the sweat output. Intake of the diuretics causes dehydration, leading to the increased incidence of the heat syndrome. Now let's understand the correlation of the nutrition and the aging. With increasing age and frailty, it becomes more difficult to maintain one's diet. Malnutrition is increasingly recognized as a problem of the elderly even in developed societies. Loss of the muscular strength with age has been shown to be a general occurrence. Nutritional deficit in the elderly play an important role in the cognitive dysfunction. Nutritional requirement in human changes in many ways across one's lifespan, and maintaining high quality of the life is closely associated with maintaining the independence in daily activities. As we all know, aging is associated with any predictable change in the physiology, function, health, and psychological well-being, with a potential impact on the diet and nutritional status of the elderly. Aging digestive tract lead to a change that declines appetite and overall food intake, and shift in the food preferences and reduction in the quantity of the food intake that can lead to the imbalance. Decreased secretion of the saliva leads to the dryness, and in the esophagus there is an increase in the non-propulsive contractions, which may lead to the difficulty in swallowing. Gastric acidity also decreases in most of the elderly population, which may in turn lead to the impaired absorption of the iron. In the small intestine, the blood flow is reduced by 40% and absorptive capacity by 30%. Carbohydrate and fat absorption declines with the age, and the protein absorption remains intact. There is a variation in the requirement of the nutrients. The specific nutrient requirement for elderly individual is based on whether the amount of the nutrient is a function of the energy intake. That is, some nutrients are required in amounts which vary directly with the total energy intake, and others are independent of energy intake. The requisite energy content of the diet rests upon the energy expenditure and will therefore be usually but not always dependent on the body size, body composition and gender, and will differ to a large extent with the amount of the physical activity. In the elderly, the most important ways in which the energy expenditure may be affected are through the basal metabolic rate, changes in the amount of the physical activity, and alteration in the efficiency of the muscular activity. At the age of the young adulthood to about 60 years, the BMR is reduced by about 10% and another 10% of the reduction by 75 years. Physical activity among the elderly is also reduced due to various factors such as the diseases, obesity, bone fragility, decreased mobility, etc. Thus, the caloric requirements decreases with increasing age as compared to those adults doing the sedentary work. As given by the Indian Council of Medical Research, the recommended dietary allowance RDA for elderly is 1800 kilocalories and for elderly female it is 1400 kilocalories. Caloric restriction as an anti-aging measure is served to be an efficient tool. Research done in the animals has seen that caloric restriction increases the life expectancy. Various experiments showed that calorie restrictions without restricting the micronutrient or other nutrients such as the vitamins is most varied anti-aging laboratory maneuver in the field of the experimental gerontology. Some of the well-recognized anti-aging actions of the calorie restrictions are: number 1, prevention of the age-related functional deterioration. Number 2, delay of the onset of the progression of age-related diseases and consequently extension of both the mean and maximum lifespan. Protein is related to the total energy output and reflects the body size and the composition. Due to decreased digestive capacity and appetite among elderly, they are likely to consume the less protein in their diet, leading to protein deficiency. ICMR recommended allowances of the protein is 60 grams and 50 grams per day for male and female respectively. Fat is a concentrated source of energy and a balanced diet should contain 40 to 50 grams of the fat. Half of this quantity should be in the form of the vegetable oil rich in the essential fatty acids. Those diet rich in the saturated fatty acids tend to raise the blood cholesterol level, while the rich polyunsaturated fatty acids tend to decrease the cholesterol. Let's come to the iron. A sufficient amount of the iron is required for a well-balanced diet for an elderly to meet the requirement of the body. It is a well-known fact that the absorption of the iron from the diet is a complex process, depending on the source of the iron. Iron stores and the need of the body. Iron deficiency anemia is common in elderly, and to avoid it, a variety of iron-rich vegetable should be included in their diet. The recommended intake of the iron among male and female is 28 mg and 30 mg per day respectively. Now let's see the role of the trace elements. Trace elements like the zinc, iodine, copper, chromium and manganese are required for the wide range of the bodily functions. Zinc deficiency in the elderly may lead to the altered taste, anorexia, generalized weakness, delay in the wound healing, and it may influence the certain diseases as well. Zinc is also an important nutritional component required for the maintenance of the immune functions. Copper plays an important role in the iron absorption, and hence this deficiency increases the risk of the osteoporosis and spontaneous fractures. Chromium deficiency is mainly characterized by the impaired glucose, lipid and the protein metabolism, and minimum chromium deficiency is common in old age. Vitamins are involved in the use of the major nutrients like protein, fat and carbohydrates. Vitamin A is found to be necessary for the clear vision in the dim light, and vitamin C deficiency causes scurvy. ICMR recommended dietary intake of the vitamin A and C is 2400 mg and 40 mg respectively. The deficiency of the vitamin B complex thiamine leads to the disease beriberi, and riboflavin leads to the glossitis or soreness of the tongue, angular stomatitis or fissures at the angles of the mouth, and the haziness of the cornea with the defective vision. Diet lacking in the niacin leads to the defective mental problems like the dementia, skin disorder and diarrhea. Now let's summarize what we have learned so far from this module. Aging of the population is a global phenomena and has become a global issue over the past several years. The epidemiological transition theory, which was first proposed by the Omran, suggested that parasitic and infectious diseases which causes death in the older time were replaced by the non-communicable diseases that lead to the increase in the life expectancy. The epidemiology of the aging is a recent field of the study that is well suited to examine the patterns of the health and functioning in an aging population. Although health issues are an important concern of the elderly, not all aged individuals are sick and disabled. Old age, being accompanied by declining health and disability, needs special care and intervention to cope with the present day. They are prone to the physiological as well as to the psychological declines as they age. Psychological declines includes the dementia, memory loss, anxiety, depression, etc. Alzheimer's disease, which is a form of the dementia, is more common with the increasing age. Bone loss or decrease in the bone mineral density leading to osteoporosis is also a common health issue related with the aging. Aging also causes many changes in the various constituents of the thermoregulatory mechanism, resulting in the inefficiency to cope with the temperature variations. With increasing age and frailty, it becomes more difficult to maintain one's diet. Nutritional deficit in the elderly plays an important role in the cognitive dysfunctions. Nutritional requirement in human changes in many ways across one's lifespan, and maintaining high quality of the life is closely associated with maintaining the independence in the daily activities. Epidemiology of aging is poised for the remarkable development in terms of the both context and methodological development. In the future, research epidemiologists should complete the stages of the epidemiological injury for the major diseases, conditions and disability for the aging. This will provide the basic line or the baseline for the development of an effective methods and guidelines for the health promotion and disease prevention in the elderly. Thank you.